Hello, everybody. Oh, and I just noticed my video is not on, but I mean, there's nothing special here tonight. Hello, everybody. Welcome to our final live parent webinar for DSDN Parent Series this season. It's been a really cool experience to try this out and see who we can get in to talk to you all and just really start to lay that foundation. We planned to stop last week, but then this popped up just over a couple weeks ago now. The American Academy of Pediatrics updated their healthcare supervision guidelines for people with Down syndrome. And it was a pretty important document for us. And so we asked if Hannah, who's one of our medical outreach directors here at DSDN, if she would be willing to come on and chat about it. So that's what we're doing tonight. I'm Jen Jacob, Executive Director for DSDN, in case you're not sure. But we'll go ahead and get started here in just a moment. As we've done in the past few meetings as well, we'll have the chat open. If you have questions, please feel free to pop them in there and we can answer them as we're going along or at the end. I know we have some time set aside for this as well. So I am going to pop off my video, but Hannah, we're so excited to have you. Thank you so much for joining us tonight.
Thanks for having me. I'm very excited about this as well. So for those of you who I have not met, I am Hannah Pascucci. I am coming to you from Western New York, and I have a daughter with Down syndrome, Juliana, who is now 7. And I am also a practicing pediatric nurse practitioner. I work at our local children's hospital here in Rochester, New York. So I'm going to kind of go through these. I have a couple slides, and then I am very open if anybody has any questions. I spent a lot of time before with the old guidelines and now with these ones reading through all of them. So hopefully we'll be able to answer them for you if you have any. So first of all, what is the American Academy of Pediatrics? So for those not like me who kind of live and breathe this all the time, the American Academy of Pediatrics is the major professional organization for pediatricians in the United States. There currently is about 67,000 pediatricians who are part of it. It does a lot of like granting research funding. It does a lot of like policy making. Like in the last couple of years, you've probably heard a ton about the American Academy of Pediatrics because they had lots of position statements on COVID stuff. Especially with going back to schools and all of that stuff. So they are kind of a research organization, a policy organization, and kind of like the voice of pediatricians in the United States. What are the guidelines? So originally these came out in 2001. They got updated in 2011, and now they've updated them again in 2022. It's a pretty big document. And it basically offers preventative care recommendations for pediatricians caring for children with Down syndrome. So it gives all kinds of best practices on what to do if you're a general pediatrician with a kid with Down syndrome in your care. And you don't know how to, what to think about, what to look for, any of that stuff. It gives a lot of those kind of recommendations. So the whole goal is to just know what you need to look out for when you have a kid with Down syndrome that you're taking care of as a pediatrician. That's the original goal of these guidelines. Why does DSDN care about them? So a major change from the guidelines from 2011 to 2022 is there's now a pretty significant section on recommendations about how pediatricians can best support families when they're delivering a diagnosis, if it's postnatally, or if they have a parent in their practice that has received a positive prenatal screen or a prenatal diagnosis. So this is either if you are pregnant with a baby that you know has Down syndrome and you have identified a pediatrician that you're going to be working with, if you already have kids. And so like for me, my daughter was my second child. And so our pediatrician knew, just like we did, we told her that we knew that this baby was likely going to have Down syndrome, and we were able to kind of work with her prenatally. And then as a parent, I reference these guidelines quite a bit just for myself. My pediatrician and I talk about them every year at her well child visit. Like, what are we supposed to be thinking about right now? Have we done this? Have we done this? Have we done this? It's kind of a good checkbox thing to think about. What best practices do we need to think about for her? So new recommendations. that DSDN has been advocating for years. So I told Jen, this was probably the first time I ever got choked up reading a research article for medical stuff. So we have our big thing that we've been working for as long as DSDN has existed is working towards how to improve the diagnosis experience for families. And I cut and pasted this table straight from the article talking about, at the time of diagnosis, what should a pediatrician do? And the very first bullet point on there is congratulate the family, have the infant present, refer to the infant by name, make sure that you're having a timely discussion where both partners are there as appropriate, use a cohesive team approach, so nobody's going off the cuff. All of those stories that Jen and I have both heard for years. A lot of these recommendations come right from what DSDN has been advocating for as best practices for years. And it's now like in print, recommended by the major pediatrician organization in the United States. So this is huge, huge, huge for us. And just as we go out and talk to medical providers about, what could be improved about the diagnosis experience, having this and the backing of this organization is huge. And then I love that they also talked about, for pediatricians who are talking to a family that's received a prenatal diagnosis, they have these recommendations just based on a lot of the research that's out there about people with Down syndrome, that 99% of them feel like they like who they are, and they encourage health professionals to value them and emphasize that they share similar hopes and dreams as people without Down syndrome. This is all the stuff that the AAP says that pediatricians should be telling families who have received a prenatal positive screen or diagnosis, which is just huge. And we love that this is the perspective that they chose to share and that they encouraged their members to share as they are talking with families in this prenatal or immediately postnatal period once they have had their baby. So just a really huge perspective and a really huge perspective shift that we're really excited about. And then they actually had guidelines about how to deliver a postnatal diagnosis as well, which is also huge. And I know this is just harping on things that are not necessarily applicable to everybody now that we have kids and are caring for these kids. But obviously this was huge for all of us on the medical outreach team, that this is in print, supported by a huge organization in the US, that this is the best practice for how to deliver a diagnosis. So, all right, the health supervision recommendations. So more practical application stuff as you're caring for a kid, or either as a healthcare professional or as a parent. So in these guidelines, which I have a link at the end for them because it's a pretty hefty document, so I did not cut and paste things for each of them, but there are guidelines for kind of each stage of a kid's life. So there is birth to 1 month, 1 month to 1 year, 1 to 5 years, 5 to 12 years. So each kind of stage of a kid's life, there are guidelines, and they go through all the different things that you should think about as, problems that can crop up that are associated with Down syndrome. What do you need to think about? So for a brand new baby, it talks about making sure that they go see a cardiologist and get a fetal echo to rule out a heart defect. It talks about making sure you do the initial screen for hypothyroidism. As kids get older, it becomes a lot more about, sleep apnea and things like that. So at each stage of life, they kind of identify all of the possible problems, but also kind of highlighting the ones that are a bigger issue during that stage of life, and talk about all the things that, you need to think about. It is geared for healthcare professionals, but as a parent, I still think it's helpful. And then they have a little anticipatory guidance section, which is basically like, what does a healthcare provider, but you need to talk to a family about next. So it's kind of like for healthcare providers when they're thinking of what they call anticipatory guidance, which is a big section that if you go look at these guidelines, you'll see It's kind of like if I'm taking care of a 5-year-old at a 5-year-old well child visit and the kid's going to be turning 6, what does the parent need to know in the next year to take care of that kid? So it's a little bit looking ahead stuff. So it has each of those sections for every age group that you can go look at and just think through as a parent, what do I need to be paying attention to? What do I need to be thinking about in regards to healthcare supervision? But then obviously, since they go into all of that with diagnosis, they do extend a little bit into social stuff too. And then if you want to learn more, so the AAP document is linked there. Jen and I can send it out to people who, if you want it. It is a publicly available thing. It's not behind a paywall the way some research articles are. If you have a Down syndrome clinic to you locally and you find it valuable to go to see them, this is what they base a lot of their stuff off of, is these type of recommendations. So if you're doing annual visits to a Down syndrome clinic, this is the sort of stuff that they would reference to. At the end of the document, they also do list parent references. A big thing for DSDN is that we were listed as one of the parent references that healthcare providers could send their parents to. So that was another big one for us. The other big reference that they listed was letter case. So if any of you at around the time of birth went to the downsyndromepregnancy.org and downloaded any of their free books or things like that, that's all letter case materials that you're interacting with there. So they're another big resource that's especially helpful in that time around diagnosis. And then Jen, we have linked here a podcast that you can go listen to. Dr. Marilyn Bull is the lead author of these guidelines. And so she did a podcast with Dr. Velody, who is the former president of NDSC, and he's the lead of the Down syndrome clinic in Pittsburgh at Pittsburgh Children's Hospital. So if you want to go more in depth with the healthcare providers who wrote the guidelines, that's a great place to start. So that is a brief overview. If anybody has specific questions, I'm happy to answer them, but I didn't want to go in depth at every age group because I know that is a lot to handle, especially if it's not an age group that you're in. It can be drowning in data. So
100%. Sorry, I forgot I was on mute. That was a great overview, Hannah. Thank you so much. And I put the link in where we have it on our website, but you can get to it by just searching health supervision guidelines pretty much anywhere online. But I pulled it up here just so you could get a sense of what it looks like. And I'll scroll back. Sorry, this will be crazy scrolling for a second. This is what the document looks like ahead of time. So you can see what's going on. And it is, like Hannah said, it is geared more for a medical provider. Generally, there are people that will put out some nice guidelines that are, nice pieces that really go along with this that are a good part for you as a parent to look at. So those aren't out quite yet. And we're working on something that will focus pregnancy through age 3, but it's not quite ready yet either. So taking a look here, what everything is going on, you'll see that it breaks it down by age range. So this is health supervision from birth to 1 month old. And so it talks about what kinds of things a medical provider might be looking at and doing along with your child as they're checking things out, the things that they might evaluate for. So for example, people who are expecting possibly heart defects are an issue for about half of our kiddos. And so it talks about that an echocardiogram would be important, and talks about some feeding things that might come into play. I really love it because it really just discusses a nice overview of all the things. It can be one of those pieces if you are overwhelmed already with information, like Hannah said, it's kind of like the fire hose approach of these are all the things. So it's a nice thing to just look at, but I definitely wouldn't, sit and spend hours and hours on this as well. But as you can see, it goes through, and then so the next chunk goes from 1 month to 1 year. So that's even a bigger section of time. And so this will talk about, what kinds of things to look at monthly checkups, like talks about at 9 months of age, what you should be looking for, things that you might be talking about with your ENT. So it's just a really nice supplemental document to really help when I first went in, the first ones were published in 2011, I believe, and Owen was born in 2012, like at the end of 2012. And when we saw our pediatrician, we had a likely diagnosis. So she knew this was probably coming on, but yet she had this all printed off already. She used it to think about which blood tests he should be getting and what things we should be looking at each time. So I was just pleased to see that. We're also working on a few pieces that could help be a nice discussion point for you and your pediatrician around this as well. But just a really nice document that, and this is research based. This is all the things that we would hope to see that they're looking at. It's probably not everything that everybody would hope to see in all of these things, but it's sure come a great way as far as we're concerned, especially around the diagnosis conversation. So we were pretty pleased to see it. And just because I am excited about it, like Hannah was saying, at the end of the document, before they go into the bajillion resources that they use to pull all of this together, they talk about the committee and the lead authors, so you can see how many people had a hand in putting all of this together. But like Hannah was mentioning, it has resources specifically for each age group. And so we were, yes, more than thrilled to see DSDN be listed on here as a resource at the prenatal and infancy time, because that's obviously our jam. It's the thing that we focus on. So we're really excited to see that. Oh, Alicia says, Juliana is adorable, unless she's talking about us, but my guess is it's.
I think we're adorable, but yes, I have a bedtime SVP who joined the webinar.
Love it.
Bye-bye.
What other questions are out there? Anything to look at? This is obviously a pretty brief one this evening, but we just wanted to be sure that you all knew that it existed and it was in your hands as well. If there's any other thoughts or questions.
Need these as well. Genetic counselors do have access to these. They actually have their own guidelines as well and resources. We just spent last Friday at the Prenatal Education Summit. One of the plus minuses of current prenatal stuff is that every group has their own guidelines and recommendations. And so the National Society for Genetic Counselors has stuff as well. So yes. Anybody have any questions?
Like
I said, I didn't want to go.
Popped in the chat. I just couldn't see it there. Sorry.
That's okay.
Yes, this is Alicia. I have a question.
Yeah.
Hey, well, my son, I just wanted to know, because, my son he's 6 months now, and he was at therapy on last month. He was there he goes once a month for the communication and development. I'm from Mississippi. Okay. And he was very, very congested. And he had a hearing test and he failed both of them. She explained to me that
you just got on mute accidentally, Alicia.
The baby did that. I'm sorry.
Okay.
So he failed both of them. And it hurt my feelings because when he was born, he had passed his hearing test. But she said what it does, I think it goes to the inner ear, the earlobe. She was just naming all three. And she said what it does, it vibrates, and it didn't do it for either ear. And my husband was like, do you think he can't hear? I said, yes, he can hear. But they did say because they get so congested, she think that could have been it. But he does have, next Thursday, he goes to see the ENT doctor, and he's going to have another hearing test. He sees the ophthalmologist for his first visit. He sees the nutritionist because he was born preemie. But we have not had any other issues. His thyroids, we just had his thyroids checked. They were fine. We just did have the little small PDA hole. He has on Monday, he has another heart scan to see if that's close. But he's been fairly normal. Every test that we've ever done other than the PDA, the little small hole. But I was a little worried about that hearing. Is that something I need to be worried about or just wait to his appointment on Thursday? Has that ever happened to any mom? That he failed both hearing tests. But they said because he was so congested, they keep fluid in their ears, and that could have been what it was.
Yeah. So, I mean, number one, it sounds like you are doing a great job of just checking right down the list of everything that would be on the guidelines for a 6-month-old.
Yes.
So I know it's a lot and you're doing a great job.
Yes.
So yes, is the very short answer.
Okay.
Kids with Down syndrome are very prone to respiratory illnesses, unfortunately. And there's a lot of kind of theories onto why that is. Some of it is trisomy 21 can affect your immune system. There's a lot of research about the 21st chromosome being connected to the immune system. And so, exactly where that all goes down gets into very deep science, but that's the short answer is it's connected. And so they can be very prone to upper respiratory infections, especially. And that can be, it definitely, the sinuses and your ears are connected, which I know people don't always think about, but it's kind of like how your ears pop on an airplane and stuff.
Yes.
And so congestion absolutely can put fluid in the ears. A lot of times when kids get ear infections, it's like it goes from here to here and then it develops in there. So I would just go see the ENT. They can do more specialized testing, but fluid in your ears can make it harder to hear. So it could not be that like he's deaf.
Yes.
But it could just be that he might have been having trouble hearing at that moment because of all the fluid.
Okay. Thank you so much. I enjoyed you on tonight.
No problem.
And your daughter's adorable. How old is she?
Oh, Juliana is 7.
Okay. I have a 21-year-old. I have a 7-year-old and I have a 6-month-old. So
that's spread.
Yes, it is. It is. And I did receive my diagnosis when we did the genetic testing and it came back 95% chance that he would have it. I cried, but I wouldn't change anything about him. Still learning and I love him just like any other child.
I just love seeing you pop on here every week, Alicia.
Thank you. I was late. I was in there. My husband brought us something to eat. And I thank God for this because I'm a new parent. This is all new to me. So I'm trying to learn as much as I can. Like I told my husband, because this is family now to me, and I have to educate myself because there's a lot we don't know. There's a lot that we're up to. I know I said my son's going to be upset. He's got a heart appointment, echo Monday. He meets the nutritionist on Wednesday, and Thursday he meets the ENT. So he's just going appointments.
Yeah. And, I would just
wrap your goals.
Yeah. I do think that is probably like those first few months are the ones that you feel like you're just going through all the checklists and making sure, that everything's going on. And I can tell you too, from my experience with Owen, he never passed the hearing test until he was literally the day we were getting hearing aids fitted. He finally started passing the hearing test. We had tubes placed because their little ear canals are so tiny, and so it helps with that draining and that congestion. That was literally one of the reasons, Alicia, that I started the first group, because I could not figure out why he was so congested all the time. And I didn't know enough to know it was just part of Down syndrome potentially for him. That's how it really came through. Like he would get croup once a year almost all the time too. But definitely with his ears. Going to the ENT was amazing for us. Getting the ear tubes, I feel like really helped. And then cleaning out that wax pretty often was really helpful for him too. And the day we went to get his hearing aids to bring home, he started passing everything because everything had just cleared out enough. So I don't think it would have hurt to go ahead and keep doing that either, because it would have, we wanted him to have the best shot of, speech and all of those things going on. I didn't want any of that to impact it. The way they described it to us too is that he was hearing, but everything just sounded muffled because of all that fluid. So, it's because I thought the same thing. I'm like, oh my gosh, like we make noises around him and he startles. So it's not like he's, not hearing anything.
Something wrong with the machine. And my husband's like, when he failed it, he looking at me, do you think our son can hear? I started to slap him. I said, yes, he can hear it.
I know. Well, in our house too, we have 4 kids and it was a loud house all the time. And he was used to that, all of those things. But so yes, just keep going with it, and talking to your providers. And I know it feels like just a lot of extra things, but I promise it does let up after a few months. And then you get to just kind of enjoy that little person for a few minutes.
Yes. No, you can't have that. Okay. Well, I appreciate you and I thank you guys, and I look forward to these sessions.
Well, that is great to know. We're going to send out, I will just kind of wrap up our recording piece here too. We'll send out a survey to everybody who's participated on these. So that way we can get some feedback about what was helpful, about what other topics you might like to hear about, because this is the heart of our mission, to be supporting new parents. So we would love to hear from you all. Our goal is to have all of this up and online sooner than later. I'll be working next week on it and hoping by the beginning of June that everything will be ready. I will get Hannah's slide deck here from tonight as well and get that up in on the resource library. So you'll be able to see all of that. We appreciate you all so much. Hannah, thank you so much for sharing your information tonight. I know this is something that has been near and dear to our DSDN hearts for many years, and you've been with us for such a long time through all of this. And I just appreciate your enthusiasm and passion for it and sticking with it. And we're making wonderful progress, and I just can't wait to see what's to come next. So thanks a million for being here tonight too with all of us.
Thanks for having me. It's exciting. Exciting time for us.
Excellent. Well, and if there's any other thoughts or questions, go ahead and we can pop off here. I'm just going to stop the recording.